Hi, this is Tina Garrity, and I am presenting the 2026 Independence Blue Cross Medicare Advantage offerings. Part of the reason why you may be interested in Independence Blue Cross is because the network support for Independence is very strong in the Philadelphia market. Independence Blue Cross is a local company offering many different Medicare Advantage products that include the largest network of doctors and hospitals in our area. First up, we're going to look at the HMO products that are going to be offered, the Keystone HMO products. Keep in mind that the HMO policies do not require you to obtain a referral to see a specialist. So let's take a look at the three more competitive products that are being offered. Keep in mind there are other HMO products available that are listed in the summary of benefits and the evidence of coverage. And we can take a look at those going forward. But we're going to focus on Keystone 65 Essential HMO, which is the $35 a month premium. This is available in all counties. Next is our Keystone Basic HMO, which is our zero premium product also offered in all 5 counties. And then lastly, the Keystone Focus HMO POS, which is offered in all 5 counties. The premium is different based on where you live. So if you're in Philadelphia or Bucks County, you'll be paying a zero premium for that plan. If you're in Chester, Delaware, or Montgomery counties, it will be $15 per month. Keep in mind that the Focus HMO POS product is part of our narrowed down network. So if you have mainline health physicians, for instance, or Jefferson doctors, this might be a good fit for you. But there are other medical systems that are not included in the network of this product. That's why we call it the Focus HMO. It is a focused, narrowed down network of providers. The Essential and the Basic HMO takes advantage of the full Blue Cross network of doctors and hospitals. The maximum out of pocket, which is the most that you would ever pay in 1 year in medical copays, would be $8,500 in the Essential, $8,500 in the Basic, and $6,750 on the Focus. The primary care physician copay is zero across all plans, $35 for a specialist in the Essential, $38 in the Basic, and $30 for a specialist in the Focus HMO. Keep in mind that the specialist copay is not consistent across all specialists. So it's important to reference the Keystone 65 HMO evidence of coverage for the copay amounts for specific specialties, such as podiatry, psychiatry, cardiologist, etc. The quarterly allowance for over-the-counter benefits on all of these plans is $60 per quarter. It is a use it or lose it benefit. Your Tier 1 prescription drugs and Tier 2 prescription drugs at preferred pharmacies are offered at a $0 copay. All of these products are going to come with the personal emergency response system for members who have a qualifying diagnosis, such as Parkinson's or mobility issues. And then the inpatient hospital stay for the Essential HMO is going to be $650 per stay. Keep in mind that the per stay copay means that if you stay 1 night or if you stay 20 nights, you still pay $650. On the Basic HMO, the inpatient hospital stay is available per day, especially for those people who aren't planning on using the hospital all that much. It's $325 per day for the first 7 days. 8 days going forward, there is no copay for that admission. The maximum you would Pay per stay, should you be in the hospital for an extended period of time, on the basic is $2,275. On the Keystone 65 Focus HMO, the hospital inpatient copay is $275 per day. Again, for the first 7 days, 8 days going forward per admission, there would not be any more copays, which means your maximum copay for an extended hospital stay would be $1,925. Worldwide emergency urgent care coverage is offered on all of these plans. Your emergency room copay is $115 on the essential, $115 on the basic, and $130 on the Focus HMO. Dental, vision, and hearing is covered on all of these three plans at no extra cost to your premium. You have access to both preventive and comprehensive services with a different allowance according to the plan that you select. Under the dental benefit, you will enjoy a zero copay for an oral exam and cleaning every 6 months, a zero copay for fluoride treatments every year, bite wing x-rays every year at a zero copay, and a comprehensive dental allowance in and out of network on the essential HMO of $2,000, in network for the basic HMO of $2,000, and for the Focus HMO in network of $1,500. The coinsurances will vary based on the plan. A routine eye exam is available on all of these plans at a zero copay. Fully covered eyewear purchase from the Davis Vision Collection, $150 annual allowance for frames and lenses through any Davis network provider, $250 annual allowance for frames and lenses through VisionWorks, or you can also use $150 allowance for contact lenses purchased instead of the eyewear. Under our hearing benefit, which is provided through True Hearing, you would have a zero copay for your routine hearing exam, and then you can purchase hearing aids. Under the Essential HMO, your hearing aids would be either $399 or $699, depending upon which aid you were interested in. You can purchase one aid every year per ear. Under the basic HMO, you would pay $699 or $999 for the hearing aids. Under the Focus HMO, you would also pay the same, $699 or $999. The hearing aids and fitting evaluations are unlimited for the first year. The Personal Choice 65 PPO products that we are highlighting today are the Personal Choice Achieve RX PPO and the Personal Choice 65 Plus RX PPO. The Personal Choice Achieve is available at a zero premium in all counties. The maximum out of pocket is $67.50. The primary care physician is a zero copay. However, the specialist is a $55 copay. The quarterly allowance is only $30 per quarter. And the Tier 1 and Tier 2 generics at a preferred pharmacy and through mail order are available at a zero copay. The in-hospital stay is, however, $390 copay per day for the first 7 days, 8 days going forward. You would not have a copay per that admission, which means the maximum copay for an extended hospital stay per admission would be $2,730. The visitor travel benefit is included in this plan, which gives you access to Blue Cross Blue Shield doctors throughout the country. More on that later. The emergency room copay is $130. On the Personal Choice 65 Plus RX PPO, it's a $214 copay, or excuse me, premium available in all counties. The maximum out of pocket is $4,201, zero at the primary, zero at the specialist, a $30 over-the-counter allowance, zero for Tier 1 and Tier 2 generic drugs at a preferred pharmacy and through mail order. Your hospital stay is capped at $400 per stay, and the emergency room is $130 at the emergency room. Again, the visitor travel benefit is included in this. Dental, vision, and hearing is also available on this plan at no extra cost. And you can see similarly to the HMO products, you have an exam and a cleaning every 6 months at no copay, fluoride treatments every 12 months, x-rays at 12 months, all at a zero copay. The comprehensive dental allowance, however, is only $1,000 on both of these plans in and out of network. The routine eye exam is included at no cost, at zero copay. And then also too, you can purchase eyewear through the Davis Vision Collection. Your lenses would be, excuse me, your frames and lenses would be covered in full. You can also choose to purchase another set or another frame through the Davis Vision Network providers with a $150 allowance on both of these plans, $250 allowance at a VisionWorks, or instead you can use the allowance for contact lenses at $150 on each of these plans. Under our hearing benefit, all members under all plans enjoy a zero copay for an annual routine hearing exam, and then also a zero copay for hearing aid fitting and evaluations, which are unlimited for the first year. The Personal Choice Achieve members will pay $6.99 and $9.99 for their digital aids, depending upon the level of the aid. And then the Personal Choice 65 Plus members will pay $4.99 or $7.99 for their hearing aid, again, depending upon the level of the hearing aid. That's also for up to 2 hearing aids per year, 1 aid per ear. Again, both advanced and premium hearing aids are available in rechargeable style options. For in-network coverage, members should use on all of the plans that I've discussed the IBX Medicare Dental Network, the Davis Vision Provider Network, and the True Hearing Networks, respectively. The visitor travel benefit is available in 48 states and 2 territories at no additional cost for the PPO plans. When members are continuously absent from a planned service area for more than 6 months, we usually must disenroll them from our plan. However, the visitor travel benefit allows you to remain enrolled in your PPO plan when you are outside the service area for up to 12 months. States and territories participating in the visitor travel benefit are subject to change at any time. Preventive services are available to help encourage you to seek, maintain, and live a healthier lifestyle. They are vital to keeping you healthy and happy. With an Independence Blue Cross Medicare Advantage plan, you are covered for a wide range of preventive services at no cost to you. That's better care and better health. If you receive a separate additional non-preventive evaluation and/or service, copay may apply. Telemedicine with Teladoc Health is available on our plans for non-urgent medical, behavioral health, and dermatology consultations, all at a zero copay. You must complete a comprehensive electronic health record online or over the phone with a designated Teladoc representative prior to using this service. Ready to use your IBX Care Card? Well, the over-the-counter allowance covers health and wellness supplies like cold, allergy medications, vitamins, etc. This is a use it or lose it benefit. It is available to use in stores at a ShopRite, a Walmart, CVS, Walgreens, Dollar General, or Family General, and more. You can also use it online or over the phone. The OnePass benefit is available to help you stay active with a no cost physical, mental, and social fitness membership through OnePass. Members will have access to local YMCA's, boutique studios, yoga, Pilates, and spinning studios, as well as virtual classes. You are also welcome to order one of our home kits and do the brain training exercises available. Transportation. Transportation is available, and food and produce benefits are available on some plans based on your diagnosis. All members on the Keystone 65 Essential Plan can receive up to 12 one-way rides per benefit year. The benefit is available to all members regardless of the diagnosis or the absence of a chronic condition. All other members, except those with the 65 Liberty or any of the personal choice PPO plans, may qualify if the member receives both a diabetes and congestive heart failure diagnosis for 24 one-way rides per year. The food and the produce benefit is available for the essential members, but members must have both extra help and a qualifying diagnosis in order to get that benefit. Members with the Keystone 65 Liberty and any of the personal choice PPO plans may qualify if the member receives both diabetes and depressive disorder diagnosis. Eligible members for this may receive a maximum of 4 weeks of groceries per benefit year. The IBX Health Rewards can help you earn gift cards for completing certain healthcare activities like your annual wellness check or bone density screening or flu shots. Registering for OnePass or attending virtual or in-person gym classes can also make you eligible for a Healthy Rewards benefit. There are up to $250 available next year in 2026. We will now review the Medicare prescription drug benefit, Part D. All plans have a formulary which lists the covered drugs and also identifies which tier your medication is. Step therapy may require you to first try certain drugs that are less costly but just as effective before the plan will cover a prescribed drug at a higher tier. Prior authorization is possible for some medications depending upon the prescription. Quantity limits may apply to certain drugs and are defined in the formulary, meaning that Independence Blue Cross limits the amount that the drug will cover. Coverage phases also are important. The deductible stage, which applies to the Independence Personal Choice Achieve plan, the initial coverage stage where you and the Part D plan share the cost of your medications, and the catastrophic stage, which you reach once you meet the $2,100 maximum out-of-pocket threshold. In 2026, once you reach this threshold of $2,100 for the year, you will no longer pay for your medications for the remainder of the year. Independence Blue Cross 90-day supply prescription drug benefit is available at the following tiers. In tier 1, at a preferred pharmacy, you will pay a 0 copay. Standard pharmacy 16, mail order 0. For tier 2, for a generic drug at a preferred pharmacy, you will pay a 0 copay, $40 at a standard pharmacy, 0 at mail order. For tier 3, for preferred brands, you will pay a 25% coinsurance. For tier 4, On the Essential HMO, you will pay 33% coinsurance, Basic 42, Focus 37, Achieve Personal Choice 30, and the 65 plus PPO plan 38%. On Tier 5 specialty drugs, on the Personal Choice 65 Achieve, you will pay 28% coinsurance. On all other Medicare Advantage plans, you will pay 33% coinsurance. Insulin will continue to be offered at a $35 per month copay or $105 for a 90-day supply. Taking advantage of preferred pharmacies is important to save money. The list of our preferred pharmacies is pretty extensive, but also includes ShopRite and CVS and Sam's Club and Giant and Target and Wegmans, as well as independent pharmacies. Mail order is also preferred to save money. And that is offered by Optum Rx. The prescription payment program option allows individuals with prescription drug coverage to spread out their out-of-pocket medication costs over the year. It lets members budget their costs. You can pay a monthly amount to Independence Blue Cross instead of paying at the pharmacy. And you can enroll in that plan for 2026 if you think that will help you. Keep in mind that in 2026, there is a $2,100 annual out-of-pocket threshold for Part D covered drugs. Ready to enroll? Well, we need to check to make sure your doctors are part of the Independence Blue Cross network and the hospitals that you want to access. And we also need to check the formulary for your prescription drugs to see what tier they are on. These are the websites in order to help you do that. After we enroll you, we will be able to confirm your enrollment shortly after helping you enroll in the plan. These are the disclaimers that Independence Blue Cross puts in their presentation. They are available for you to read. If you have any questions or you're interested in enrolling, please feel free to reach out to us through our website, through email, or at any of our numbers. Thank you very much for your attention.